our viewers to another webinar that's being hosted by Crownell Co and Sinbel Advocates. This is another webinar in a series of webinars that we've had discussing pertinent issues that are going on within our country. So today's webinar is a very special one. We're going to be looking at the medical profession, what is happening in this profession. Particularly, we're going to be focusing on the nurses in our community. So like I mentioned earlier, this webinar is brought to you by Crownell Co and Sinbel Advocates in partnership with the Nurses and Midwives Leadership Think Tank, and will be moderated by myself, Joyce Katende, and Dr. Rose Clark Nanyonga. So allow me to first of all share with you a little bit about Dr. Rose. Dr. Rose is the Vice Chancellor and Senior Lecturer at Clark International University. She also holds a senior faculty position teaching health policy and planning and advanced strategic management. Her CV is quite long, but I'm going to try and summarize it for those of us who are just getting into this and trying to understand what she does. First of all, she has a very robust education background, where she has a Bachelor of Science from Arkansas in the USA. She has a Master of Science in Nursing from the Baylor University. She also has a PhD in Nursing from Yale. She has a Graduate Certificate of Concentration on Global Health from the Whitney and Betty Macmillan Center of International Studies at Yale University. She's a Jonas Scholar. She's a Distinguished Alumni of Yale. She has a Hall of Distinction Award. She is also interested in research and explores issues relating to health systems, strengthening particularly low to middle income countries, as well as management of chronic illnesses, healthcare, to mention but a few. Like I said, her CV is quite robust, and I am so honored to be able to moderate such a session with such a distinguished member of our nursing fraternity. Dr. Clark, you're very welcome. I hope you can hear me. Can you say hello to our listeners? Hello, Dr. Rose, can you hear me? Dr. Rose, you may need to unmute your microphone so you can say hello.
Not able to hear you very well.
Hello?
Hello?
Yes, I've just finished introducing you, and I would like you to say hello to our listeners.
Hello, listeners. Thank you, everybody, for being here.
Yes. I think we seem to have lost.
And I'm delighted to be here. Before I take this opportunity to introduce is our co-moderator, a lawyer and an advocate of the High Court, and corporate trainer with a Master in National Human Rights and Alternative Dispute Resolution. She's a human rights and gender activist, having both on a commissioner with the Equal Opportunity Women's Lawyers FIDA, person of the Rotary Roses, immediate past president of Rotary, now club now, and Service Above Self, who is going to be my co-moderator for this webinar. Thank you, Joyce. Over to you.
Thank you, Dr. Rose. It's a pleasure and honor to be hosting this webinar about the future of the nursing profession and healthcare with someone with your robust background. Like I mentioned, like she also mentioned, my background is law, but we have a specialist in the house, and we have a very distinguished panel that is going to be sharing with us some of the challenges and the way forward regarding our nursing profession. But before we go into the different panelists, I would like to say a bit about our sponsors. Like I said, this is a webinar, and we are, I think, in our 4th or 5th series. and it has been brought to you by Crownell Co, which is a company body corporate, which comprises of a pool of skilled legal professionals. And it was established in January 2019, but already in this period of just over a year, it has managed to expand its borders and venture into territories that many legal companies are not actually venturing into. It's particularly offering legal services and thought leadership on topical issues on a national and global scale. And that's why we're here. Much as it's a law firm, it's looking at what are the issues now facing the medical profession. The week before, 2 weeks back, we looked at what are the issues facing the education profession. And we have gone into, the whole COVID scenario. So it's one of those really unique body corporates that is looking out for the interests of all of us and trying to give us a platform for us to be able to express ourselves and understand what is the legal framework governing all these institutions and how can these institutions help us in our current situations. So like I said, it's a premium legal consultancy entity, and it offers a wide range of advisory and transaction advisory services. So if you're thinking like I'm thinking, you're looking at how, where can I go to get the kind of legal advice that will make business sense, that will make human rights sense, go no further. So that's it about Crownell Co. And I would like Dr. Rose to tell us a bit about NLMTT. Over to you, Dr. Rose.
Thank you. I'm told my network is not great, so I'm going to cut the video so that I'm a little clearer. Think Tank is an initiative country who recognize the need to advocate and support nurses and midwives are on the front line, and we came together to have an amplified voice for the sector. The think tank aspires to achieve the following objectives: to advocate and support nurses and midwives across the country during the COVID-19 pandemic and beyond, and to work together with the National Task Force at the Ministry of Health to ensure inclusion and contribution of nurses and midwives in the planning processes of the national response to COVID-19. The initiative draws together nurses and midwives leaders from various ministries, the Ministry of Health, the Ministry of Education and Sport associations such as the Critical Care Nursing Association in Uganda, the Association of Graduate Nurses and Midwives Leaders, training institutions and academia, and other nursing leaders from respective national and regional referral hospitals, among others. The objectives of this webinar for us today is to be able to look at the role of nurses and midwifery leadership in serving the nation, and also to highlight the role of effective nurse policies, education and investment, as well as highlighting the role played by nurses at the front line during COVID-19 and lessons that have been gained or challenges that they have experienced, and to be able to project those changes in the nursing and midwifery professionals. So I would like to give back to you, Joyce, to go over panelists. So would you like me to go through our panelists and introduce them?
Kindly go ahead and introduce them, then I'll start the interview process. Thank you.
Brilliant. So I'm delighted to introduce to you our panelists. We have a distinguished panel of speakers for us today. And the first one is my colleague, Dr. Hajat Safina K. Musene, the Commissioner of BITVET, and also the chair of the nurses and is the commissioner of BITVET at the Ministry of Education and Sports since May 2017. Prior to that, she was the principal of Mulago School of Nursing and Midwifery for a total of 10 years. She also served as the principal of Ginger School of Nursing and Midwifery for 11 years and was the principal tutor at the Health Tutors Mulago College in Uganda. She has a doctorate of philosophy in clinical teaching and learning and nursing from the University of Cape Town, and she holds a master's degree in education from Moi University, is a licensed tutor by the Uganda Nurses and Midwives Council since 1993.
Thank you so much, Dr. Rose. And now, after, with such a CV, we only need to see the face behind such a lovely CV. So I'm going to request Dr. Safina to say hello to us before I start the interview process. So could you please say hello to us?
Thank you very much, Madam Joyce and Dr. Rose, for the introduction. And dear viewers, I'm happy to be with you today to discuss the topic as it was introduced by the moderators. Thank you very much.
Thank you, Dr. Safina. I'm used to calling you Hajat. One of the reasons I really wanted to interview you today is we have something, much as we are in totally different professions, we have something that brings us together, and that's Rotary. And both of us, having just been presidents of our clubs, it's an honor to work with you and to share with you beyond the Rotary fraternity. So now, with that, I welcome you once again, and I'll just dig right in. So looking at the fact that you're a commissioner, you work with the Ministry of Education and Sports, I want you to enlighten us more on what the Nurses and the Midwives Leadership Think Tank is. What is this and what agenda do you drive?
Thank you very much for that question that you have posed. As an educationist and as Uganda Nurses Midwife Think Tank, Leadership Think Tank, what agenda we are taking on board. I want to, as Rose said, this organization or this team was formed in April this year, and it was mainly in response to how we could help our frontline nurses in relation to COVID-19. So a group of senior leaders in the country came together and we started a voluntary collaboration fellowship to see how best we can support our fellow nurses. And this voluntarism includes the Ministry of Education, Ministry of Health, academia like the VC of Dr. Rose from other universities, the associations, and everybody. Majorly, we wanted, as nurse leaders, to see that the nurses, we know very well that they cover more than 75% of the health workers of any country. So we wanted these nurses to be evenly distributed at all levels of service delivery, starting from policy level up to the lowest facility service delivery level. And mainly in terms of leadership competences and also in terms of clinical competences in relation to COVID-19. We realize that as they provide the services, they will be put at risk of service delivery and after interaction. And through our leadership, we were able to do a survey that generated a lot of information that guided our interaction. That survey showed to us that the personal protective gears were not enough, that the knowledge of these nurses as far as prevention and control and the management of COVID-19 was still limiting. The leadership, of course, were even appreciated that by then we did not have a head nurse at the Ministry of Health. The leadership was still wanting, which is still the case even up today. So this think tank came in with that motivation of ensuring that this nurse, this midwife, is brought at the action point. So far, what we have done and what we have achieved, we have made this as a routine that every week, every other 2 weeks. Before it was every week, but now it is every other week. We keep on meeting and discussing issues that pertain to us as nurses. We met the head technical person in the Ministry of Health and we were able to present our issues. And one of them was, yes, we have taken long without a leader for NASI, a chief nurse, and we were informed that they were in the process, and we are happy to report that Mrs. Amuge Beatrice was appointed as the Commissioner Health Services in charge of NASI and midwifery. And to us as think tank, we think that we made a contribution towards achieving that. Also, in our group, we thought of making a contribution to motivate, to remedy where there was a challenge, and mainly in the personal protective gear, that we fundraise the funds. And now, Grace, you know, the Rotary Heart in me, we fundraised the funds, and then we went and procured masks, which we distributed to the nurses of Mulago and the Entebbe hospitals. And still, this move is still on. We are still mobilizing resources to see that we support our fellow nurses. In the area of education, we are still advocating to ensure that the nurses, for whatever services that they are delivering. Right now, we are talking about COVID-19, but also we have other conditions. So we want to ensure that in everything that they do, they are competent to deliver, and therefore we are advocating for adequate upgrade of their skills and regular upgrade of their competences depending on the need of their service delivery. In our interaction, the meeting, we have had various speakers who come and talk to us. We were able to get the commissioner in charge of clinical services and talk to the nurses. And all that we think it is in the area of us as nurses, and we are supporting them as leaders. This, I don't know whether I'm speaking a lot.
No, I can hear you. I can hear you. Can you hear me now?
Yes, I can.
Yes. You've, from basically what you've been sharing with us, you're telling us that this think tank is basically some kind of association where you're bringing together nurses, and you're trying to ensure their welfare is taken care of, that they're evenly distributed, all across the country, to ensure that services are brought closer to the masses and to the different people. I want you to tell us a little more about, one, how are you protecting these nurses, especially in the wake of now when you're thinking about issues like COVID. The COVID pandemic, these are the front runners. These are the people who are directly interfacing, both those who have been diagnosed maybe with COVID or, whatever other infectious diseases. One, I would like to know, how have you responded as the think tank, as the overall body that is looking out for the welfare of, nurses, male and female, who are on the front line? How have you responded, and how are you protecting them? Thank you.
Thank you very much. As think tank, we are an advocate body. We are an advocate body that is working to ensure that the nurses, wherever they are, the risk is reduced. And that's why I was telling you that we procured the personal protective equipment for the 2 hospitals where we started having patients treated for COVID-19, and they were distributed. And these were handed over to the committee that is responsible for mobilizing resources for the country at the Prime Minister's office. Still, as think tank, the way we ensure the protection of our nurses is through training them so that they are able to appreciate how to protect themselves, how to manage themselves, how to prevent such risks within the working environment, and so on. And specifically right now, there is a university that has started taking them a 3 days training of our nurses online to ensure that they get such competences to be able to prevent any risk to them. The other way how we are ensuring that they are protected, we are in close contact with the chief nurse of the country and also the regional referral hospitals to see that they keep on observing the preventive measures for not to get COVID-19. I'm not sure whether I've answered you now.
Thank you, Hajat Safina. I'm glad to hear about all these strides that have been taken to protect our nurses who are on the front line. I wanted to know from you, have you been able to get any kind of assistance from government? Because from so far what you've shared with us is you have this internal mobilization strategy and what you're doing. I wanted to know, how is government also coming in and maybe assisting you, seeing as you're on the front line? And maybe you could also share with us, have you had any casualties, because you're right there interfacing with the public?
Yeah. Now, the assistance from government is in a way that the Ministry of Health has continued providing the necessary requirements for managing these patients. When we met the permanent secretary, we were informed that personal protective gears were provided in the hospitals, that facilities for transportation of these nurses and other health professionals were provided for them to be able to move from home to work and back home. And by that time, we were in total lockdown, that all public means were controlled. So such facilities were provided to support. Nutrition was improved for them, and food was provided to those health workers that were on the front line. And we witnessed this even through videos that were taken while they were in Mulago, when they were giving trays of eggs to the nurses and other resources that were required for service provided. Also, the working environment was improved. Facilities have been provided in terms of facilities for treatment, facilities for quarantine of those people who were exposed, and the government is able providing for them, provide for food, they provide for beddings, they provide for the sanitizers, soap, and so on, all those things that they use in the prevention. Then education, government is on the front line ensuring that the people who are providing services, there is a program. Though all of these things that we are talking about, resources in the world are never enough. Whatever they provide may not be adequate enough. And we have been hearing voices from the nurses whom we have been interacting with that some resources are not adequate.
Okay, thank you, Dr. Safina. I have a series of more questions for you, but I'm going to put it on hold because we are now going to hear from Dr. Rhoda. But as you're thinking about when we come back to you, one of the questions I would like you to talk to us, to share with us is regarding the BTVAT, what it's doing, and what does the training of these nurses in the future look like in the post-COVID era? So think about some of those. And now I would like to hand over to Dr. Rose to introduce our next speaker, Rhoda, and maybe have a few questions for her. So over to you, Dr. Rose. Dr. Rose, can you hear me?
Hello, Joyce. Thank you very much. Thank you, Dr. Safina, for your presentation and for highlighting the work of the Nursing and Midwifery Leaders Think Tank. I know that you've spoken about advocacy. It's a critical issue. And also what the ministry talk a little bit more about infection and prevention and control. So I would like to introduce Rhoda Tugumye, who is in case management, as well as medical maintenance. Ms. Rhoda is unit at Imbarara Regional, in charge of the medical ward at Mbarara Regional Referral Hospital. She has also worked at Kisizi Hospital as a nurse, and she from Mbarara University of Science Management. From Kabale University, India School of Nursing and Kabale School.
Hello, Dr. Ross, we seem to have lost you. Are you still there?
Jace, can you hear me?
Now I can. Now I can. Please continue.
Hello?
Hello, we can hear you now.
Can you? Okay. Should I proceed with the questions for me? Thank you very much. I apologize about that. I got disconnected. Ms. Rhoda, tell us a little bit about IPC and what role it does play in our healthcare system, especially now during the COVID-19 pandemic. Ms. Rhoda, over to you, if you can hear me. I can't seem to hear Ms. Rhoda.
Ms. Rhoda, can you hear us? Madam Rhoda, can you kindly unmute your microphone, please?
As we troubleshoot, Ms. Rhoda, perhaps I can move on to our next panelist, Mr. Cliff Aliga.
Thank you. Please do. Dr. Rose,
I think as we troubleshoot, Ms. Rhoda, I would like to move on to it and see what is happening with Ms. Rhoda. Ladies and gentlemen, let me introduce our next panelist. We will get back to Ms. Rhoda when her microphone has been sorted. Mr. Cliff Aliga is another one of our panelists. He is a senior faculty lecturer at Aga Khan University. He has devoted 70% of his work, and he has a 20-year of multi-cultural. His extensive, vibrant quality nursing care service, improving emergency care services and mentoring nurses within that discipline. Mr. Cliff is the current chairperson for the Critical Care Nursing Association of Uganda and also the president of the African Federation of Critical Care Nurses. He is a board member of AFSIS Alliance. Mr. Cliff at the University of South Africa. Welcome with me, Mr. Cliff. Thank you for being here. I know that critical care nursing is really important to the COVID-19 management. I would like what is critical care nursing after a few months since the COVID-19 pandemic started?
Thank you, Dr. Rose Clark, and thank you, listeners and viewers. Ladies and gentlemen, the question about what is critical care nursing? Critical care nursing is one of the many specialties that nurses can undertake, and the way the critical care nursing specialty is designed, it is designed to train nurses who take care of patients.
I know that critical care nursing is really important.
Dr. Rose, I got the question. Can I proceed to respond?
Yes, I think there seems to be a delay. I actually finished. I would like
there seemed to be a network breakdown, but I was able to get the question that what is critical care nursing and how has this evolved over the past months? Am I correct?
Yes, you are. Please proceed.
Okay. Yes, I would like to proceed, and I would like to explain that critical care nursing is one of the specialization program that nurses undergo through. And when these nurses undergo through a specialized training, which is called critical care nursing, these nurses are specifically trained to work with the patients who are seriously ill. And in many cases, in an ideal situation, these patients are supposed to be admitted in intensive care unit. So they are really a group of nurses who are really trained to work in intensive care unit or in emergency department for patients who are seriously ill and who really need life-saving interventions. And that's what critical care nursing is. And the fact that we're asking about the evolution of critical care nursing in the past few months, I will presume that we're referring to the past few months of the COVID pandemic. Yes, the evolution of this cadre of nursing has evolved, realizing that in the global pandemic of COVID, there has always been a need for taking care of patients who are seriously ill. And I'm sure all of us have watched in the TVs how developed countries are struggling to take care of their patients in ICU. And this has evolved because that is actually what patients who are seriously ill will need in the COVID pandemic. And particularly, I will also say that in Uganda as per se, government was able to respond very quickly to actually activate restructure our hospitals to really cater for this particular category of patients who need intensive care unit by opening up our ICUs. Particularly, I will refer to Mulago National Referral Hospital, because you all realize that by the time COVID pandemic came in, Mulago National Referral Hospital was undergoing renovation. But the government was able to quickly open this facility, particularly to make it available to take care of patients who are, having COVID and probably also having severe illness. And there was also an evolution of the need to recruit more staffs, particularly those staffs who can actually work in intensive care unit, particularly those who really have experience in working in ICU as a specialty or in a high dependent unit, or even in some of the CTU centers. And then there has also been evolution of the needs to develop skills training programs in the country, because as a country, we have not moved so much in terms of training nurses in that specialty. So some institutions have already developed some training programs to train nurses on how to work in ICU. And there has been also a very good, move made by Ministry of Health to really make available some money or some funds to recruit some nurses who are working in a regional referral hospital to really beef up the staffing levels of nurses who work in HDU, high dependent unit or in ICU in these regional referral hospitals which have the setup of ICU. Besides that, even in universities like Mbarara University, I remember that they advertised for scholarship, which is actually being sponsored by Ministry of Health, to train nurses for a skills development training program, which is actually yet to start this month. And I'm very sure many of the nurses are already aware about it. So these are some of the evolutions that have happened. And even recently, the Critical Care Nursing Association of Uganda has had a Zoom experience sharing, particularly involving nurses who are working in COVID treatment centers, to really share the experience of how they have been taking care of patients with COVID. We're definitely very proud that very few patients passed away in the previous months, although we are beginning to see mortalities. But these nurses have shared a very touching experience, how they are coping up with the COVID pandemic and how they're managing the patients. So I will say those are some of the evolutions in terms of critical care. Much is yet to be done, but those are some of the key things that have already evolved.
Okay, thank you so much for enlightening us more about, this whole concept of critical care nursing. Yes. And I'm sure you'll agree with me, probably prior to the COVID, the whole COVID-19 epidemic and all that, probably it wasn't at the forefront, critical care nursing. And now with the whole COVID thing coming up, I'm sure you've been able, and probably government also has been able to see some critical care gaps in the system. So I wanted you to share with us what are some of these critical gaps that you have observed and how are you managing them? Because now all of a sudden you're at the forefront.
Yes, indeed, Joyce. The critical care nurses are on the forefront there. You find them in HDU, ICU, in emergency department, and indeed also in COVID treatment center. And there has been some challenges. And these challenges in terms of gaps, we'll classify them in about 3 or 4 categories. The first category I will say that is one of the first categories is there has been a gap in human resource for critical care, particularly nurses who are trained as a specialized critical care nurses, or even anesthetists, anesthesiologists who are supposed to work with these nurses in ICU, or even critical care physicians. These resources remain lacking. I will quickly give you some small statistics about how critical in terms of the human resource of critical care. For example, if you take a quick survey in the whole country, which a lady called Atumanya had already done some quick survey, you only find that there are only 55 ICU beds in this country. In terms of that, the number of nurses who are working this ICU the total number is about 171. And when you look at the number of nurses who are working these ICUs, there are only 13 of them who have taken a formal training in critical care. That brings it to about 7.6% of nurses who have really specialized. The rest of the nurses who are working there have either learned through experience to work in ICU, or they have just done some skills development training, which do not necessarily make them as a critical care nurse, but they are giving work that's supposed to be done by a specialized nurse. And when you translate this few number of nurses into the statistics of our population, you will find that for every one nurse, this nurse will be responsible for about 1 million, patients. If you look at the statistics, which stands about 1.3 ICU beds for every 1 million patients. That's a very huge number. And if you translate that further, it will mean that you will have 1 nurse for every 8 patients in ICU, which is something that we cannot actually be proud about. And of all these, only 13 have a formal training in ICU. And I will leave it to you to determine what kind of quality are we providing in ICU in that matter, especially where the quality of the people who work there in terms of the education level is a big challenge. And the second challenge, which the second gap, is that ICUs require high technology equipments. And you know that for any bed, any ICU to be called an ideal ICU bed, the ICU must have particular things available to be qualified as an intensive care unit. For example, they must have equipment like a ventilator. They must have monitors. They must have some advanced level equipment. And we are only sure in Uganda that there are only 55 of these that are already available. And if you look at that, coupled with the lack of specialized nurses, the few anesthesiologists, which are less than 30 in the whole country, it brings a very big challenge in terms of, the gap that we really need to bridge this gap. And even besides that, the number of patients who will require ICU, should the COVID pandemic become more severe in a way that needing ICU, our capacity is still very limited. Because for the population, if they have severe COVID, about 10% will need intensive care, 10 to 15% will need ICU. And we're beginning to see this kind of things happening because many of the patients who required ICU in this country, a few of them have passed, because right now we have about 10 mortalities so far by yesterday. And that simply explains the challenge we're already having in terms of our gap. But if you also look at that, the human resource to train nurses who have critical care is still limited. I will give you an example as a fact that very few nurses who have done these courses are actually in the country. Less than 50 nurses who have done specialized training in critical care are actually in this country. But you realize that their capacity to train intensive care is still limited because the equipments, the skills lab that are required to train these nurses are still not available. We're not well resourced in terms of that. And even besides that, these nurses who have at least done some formal training have not been recruited to work in many of these hospitals. Majority of them are working in education institution. These education institutions are not necessarily training critical care nurses, but they're training a general, aspect of nursing as such. It means the nurses who could have built the capacity of nurses to be specialized are there, but we have not put up the institutions. There's only one university that is training critical care nurses, which is actually not enough. And this particular university is only graduating between 8 to 10 nurses every year who have trained in critical care nurse. And that's one of the biggest challenges we're having. Yes, back to you.
Wow. From what you've said, you have really, now for someone like me who is not from the medical profession, you have really scared me, because if you're saying that the current situation that we have about 13 formally trained nurses for critical care, that leaves us really open to all kinds of diseases, all kinds of casualties and fatalities. And it's really scary for us as regular Ugandans to hear something like that. So when we see that you're saying that, in terms of capabilities, in terms of those who are formally trained, we only have about one nurse for every 1 million patients. I actually shudder to think how we have survived this long. So I'm wondering, and I'm sure many of us who are listening are wondering, how is this happening? How are we surviving? And what is government doing about this? And you're part of an association. What can the associations do to help, the nursing profession? Because if we have just about, 13 or so formally trained, that means our lives are at risk. That means every time we go to hospital, we are being treated and handled by people who are probably just gambling. Is there some kind of, upside you can share with us? Is there something that is being done? Because now it's getting very scary for those of us who are listening.
Yeah, Joyce, and those of us who are listening, yes, we are right to be worried, and we should actually be worried. And God forbid that we should actually not be having severe illness that usually requires us to be in ICU. And I know that sounds very scary, but let me say that those of us who are religious, we believe that God is also with us. But those of us who are not religious, we should also know that we must take action. And these actions are really always being explained by government. And the fact that these challenges are there, we are not sitting down. Government is also not sitting down. Government has taken steps. There has been a lot of promises from government, for example, to bring more intensive care equipment to this country. And I'm aware about some efforts that have been done to really prepare at least not less than 10 ICU beds in every regional referral hospital. We have about 14 regional referral hospitals. Every regional referral hospital is now preparing to start setting up intensive care unit. Those which already have ICU, they are preparing to, beef their capacity in terms of training the nurses, in terms of conducting a continuous continuous professional education for nurses. Even there are also scholarships that are currently available, being offered by government, on the realization that critical care nurses are inadequate. So there has been effort to advertise, adverts have run to recruit some nurses to be trained for 6 months, and Mbarara University will bear me witness about this. They have advertised that, and they have seen the intake list for the master's program, and these are some of the little efforts that government is doing. Much as we're getting worried, there's some effort, but the issue is that these efforts that have been put there to recruit, to train, and to buy equipments is not going to be realized in one day. It is going to be a process, and we need to remain calm. We need to remain vigilant. We do not need to see that when we fall sick, we do not have to remain at home. You need to come to the hospital and get treated. And right now, as an organization, we have started training nurses online. But the fact that with the lockdown, we're not able to sit in classrooms, we're now training nurses online, developing some little a competence building training program. For example, in Aga Khan, we train some nurses in Uganda, in military barracks in Bombo. We're able to conduct a webinar every 2 weeks, where it has been attended by nurses. Nurses who are working in ICU, in COVID treatment centers, are sharing their experience of how to take care of these patients with limited knowledge, with limited skills. And those are some of the little efforts. And as an association, I'm asking partners, interested organizations, to really come and support, because nurses who want to train on these programs will require to be supported in terms of giving them time to do this training, supporting them with the funds to get access to internet, even to allow them off duty to go and take some specialized training are some of the things that we want to advocate for. And even the managers of these institutions, where there are ICUs, they should take note that if we don't prepare ourselves now, we are going to see more mortalities. We're likely to see severely ill patients passing away because we may not be providing the best care. I'm not very sure why the 11 patients or 10 patients who have died, why they passed away, but it could also be related to the lack of capacity, lack of equipment, lack of the vigilance that we have. And those are the challenges that we're dealing with right now.
Thank you so much, Mr. Cliff. We still have several questions for you because you've opened literally Pandora's box, and now all of us are shivering and sweating. But I will be coming back to you with more questions on that to help alleviate some of the fears that you have now generated. With that, I would like to now go to Rhoda. I don't know if she's on. If you're on, can you kindly say hello so we know we can hear you? Rhoda, are you on? Hello? I think Rhoda is still having some challenges. I would now like to go to Angela Ilakuta. Are you there? Our Registrar of Uganda Nurses and Midwives Council. Are you there? I am there. Madam Registrar, you're very welcome. It's good to finally have you on. We have been anxiously waiting to hear from you. Before we start, I would like to introduce you to our listeners. This is a webinar that has been brought to us by Crown Co and Sinbel Advocate, together to really highlight what are the challenges that the medical profession, particularly nurses, have been facing, what is going on, especially in light of the COVID pandemic. And we're not only looking at COVID, but we're also looking at what happens after COVID. And so that's why it was really critical to have you here as the registrar of the Uganda Nurses and Midwives Council. So allow me just a minute or two to share with our viewers a bit about you. So Madam Angela Ilakut is the acting registrar of the Uganda Nurses and Midwives Council. And this is a licensing body for nurses and midwives in Uganda. And prior to this appointment, she was the Assistant Commissioner of Nursing at Butabika National Mental Referral Hospital. She holds a Master's of Science in Nursing from the Uganda Christian University and a Bachelor of Science in Nursing from Aga Khan University. Madam Registrar, you're very welcome.
Thank you.
And so I think at this point I'll just dig in and ask you, the first question that came to mind is, can you help our listeners? We have listeners both on the web now, we have listeners on Facebook at the Crownell Core Facebook page. Can you help those listeners who are not from the nursing background like myself to understand what UNMC does as well as its mandate?
Thank you. Uganda Nurses and Midwives Council is a regulatory body which is mandated to set standards of training and practice, to register and license nurses, to enroll nurses in the register, and to discipline nurses where they have gone wrong. That is the mandate, actually.
Thank you, Madam Registrar. Okay, this isn't part of the lineup, but am I right to say that if I went into a hospital or a clinic and somehow I didn't have the proper maybe bed care service, proper attention from the nurses, you are the body that I can call to discipline that nurse? Is that what you're saying?
If there was something that went wrong during the course of providing care, then you call us and we investigate.
Okay.
Yes.
Thank you. So now, my next question is, how has your work at UNMC been affected by COVID-19? Especially because since your team serves the entire country, but part of the strategy against COVID-19 is limited physical contact, movements, and social distancing. So how has your work been affected by this pandemic that has hit us?
Yes, the pandemic has affected us a great deal, indeed a great deal. One of the issues that we faced was when the close down was brought in, first of all our vehicles were taken away by Ministry of Health to help in the task force. And so that one crumpled us and we had to sit back at home without doing anything. Remember, as regulators, we are supposed to move in the field, to be giving support to our colleagues, to see what they are doing, and to guide them in whatever they are doing. But this took all our transport, and we remained. Definitely, the COVID affected us because we closed down to follow the directive of the president, but also the guidelines of the ministry. Given that we have great numbers of nurses who have qualified and they usually come here to pick their certificates, but also to do registration. So we were affected and we closed down all the services. This place pulls a large number of clients. In a day, we can see like about 300 of them in this place. And so we said, we cannot continue this. Let us put a halt. Definitely, we could not register, and we have a very, very big backlog of candidates who are supposed to register. The whole of candidates from March, April, May, and then June. There is another group that came out. Those ones we have not yet started. That's a very big backlog. And then also, of course, in terms of material, as you saw that shops were closed, companies were closed, it was difficult to get the materials online. However, the period gave us time with the material that we have to try and prepare a lot of certificates for those that had already done the interviews. We prepared a lot of them, and then when there was when the first unlocking down started, we also said, let us start allowing them in a first manner to come and pick their certificates. So we also opened a bit, and now they are picking their certificates, and numbers of them have picked their certificates. Remember that the nurses were on our neck, saying that there are jobs now, and we cannot do interviews, we cannot have our certificates, but we prepared the certificates during the lockdown. We didn't close completely. I personally was in the office with the chairperson of the registrar to sign those certificates. With one at least a few skeletal staff to prepare the certificates. So it really affected us. We couldn't do our field work because of all this COVID-19. And obviously, even now, when we have opened, many of them want to come and do the interviews, to be registered. Many of them want to come and pick their certificates, but we are saying, no, we cannot allow a bigger number of them to come. We have made a way forward on how to have them pick their certificates. We use our website to put in their names so that when they look at the website, they will see their names there. And if their names are there, they come and pick the certificates. Obviously, not all of them look at the website. Some of them just come. And then others call us and we say, okay, please, your certificate is ready. Can you come and pick? So we've been quite busy, at least trying to get certificates that are ready. As of now, we haven't yet started the registration. We are still planning on how best we can start registering them because of the numbers that we expect to come here. We shall also look at how we can go ahead. Definitely, we have plans. We have plans to go online, and we are in gear to prepare our system, at least to try to have registration be done online.
Okay, actually, that leads me to the question. You've kind of started to answer it. How has the COVID-19 changed the way registration works? But it looks like from what you're saying is currently you're not carrying out any registration because of, the social distancing and the movements. But now, what is the thought process? What are we looking at? How are you going to move forward from where we are right now? Because what COVID-19 has done is it has totally changed how everything works. We can no longer go back to, the previous manual systems and all that. So what I would like to pick your brain to know, what are you thinking of in terms of changes regarding how the registration works? How different will the process be for the nurses for the next 1 or 2 years? Because right now we really don't know how long this whole scenario is going to last. But at the same time, we need your professionals to be out in the field serving the public.
Yes, definitely technology came in and we are embracing the technology. And as I have already started hinting on it as you heard, we have planned to go online, and actually we have started this. Before the COVID, we had already had ideas of going online inside Uganda to benchmark on how we can to put in the systems to go on. We are also planning, and then the information is related to us, and we're able to register them. That is where we are going. Definitely, we have embraced it, and we have actually started on the process. My IT department has started formulating the systems. We are right ahead, and only that we need to look at is issues of policy on how we shall go there. Otherwise, we are looking forward to being going on digital, and actually by the end of this year, hook or crook, we might be having people registering online.
Okay, that's excellent news for us to hear, and I'm sure for us who are the recipients of those services and those of the different nurses who really want to get registered. I'm going to ask you one last question before I put a pause on your interview, because we have some other panelists. Something that was mentioned by a panelist earlier on who was talking about, critical care nursing. He mentioned the fact that we have basically one institution that churns out about 8 to 10 specialists, like every year. And then also about, the formal training, we have about 13 who are like formally trained, and many of the other nurses are just learning on the job. And I'm wondering, you as the body responsible for registering and giving licenses to these nurses, what is being done about that? Because for us as a public, when we had such statistics, already we've gone into panic mode because we are thinking we are being treated or cared for by persons who might not necessarily be licensed. And when you go into a hospital or a clinic, you go with an ailment and you're not thinking about first asking the person, do you have a license? Let me look at it and that kind of thing. So can you advise us on, what is the way forward for such situations and what can be done?
Thank you. That was my brother, Cliff, who was talking about critical care. It is true what he said. We have a few critical care nurses because the curricula that is training the other nurses other than masters has a very small component in critical care nursing. And what, as regulators, we are just calling upon the trainers or the schools, their curricula, so that many of the nurses are trained as critical care nursing. As you heard him say, in the curricula that trains general nurses, there is a very small component of critical care nursing. And that's why they are able to give the nursing at their levels where they are working. And that's why we've had a low rate of death when this COVID came in, because the nurses at least have some knowledge. But I think what I could say is that maybe other universities should take up to train nurses at that particular level. What I want to say is that the council registers all the nurses. We now have nurses trained up to masters, up to PhD. And we have agreed as council that when they train at that level, their area of specialization will be captured when they are being registered. And we have started doing that one.
Okay, thank you so much, Madam Registrar. Like I said, we have several questions that are coming in, and when I come back to you, I'm going to pose some of those questions to you, but in the meantime, you can look at them on the chat. Several people have a number of questions for you. I would like to now go to our next panelist. I just want to know, is Dr. Rose back online?
Yes, I am back online. Can you hear me? Is my
Yes,
network
we can.
better?
Much better.
Okay.
The light is there.
Okay,
All right.
can
Thank
I-
you so much.
Hello?
Hello.
Yes, Dr. Rose, I would like to hand you to Rhoda. You had started, so now I'm handing over to you now.
Thank you very much, Joyce, for hosting and for covering me. And I apologize to our listeners for the network glitch. I had already introduced Miss Rhoda. I would like to know if she is actually now online and she's able to take some of our questions. Miss Rhoda, are you here? Hello, Miss Rhoda. Thank you for being here. I want to go right back into the questions we had introduced to you to our viewers. And we know that you work as a trainer in infection prevention and control. Please explain to our viewers, what is IPC and what role does it play in our healthcare system, especially now during the COVID-19 pandemic? Ms. Rhoda?
Hello?
Did you
Hello,
hear my
could you hear
question?
me?
Yes,
Yes,
we can
I did.
hear you. Yes,
Thank you very
please
much.
explain to our viewers. Yes.
Thank you very much. I'm going straight away to the question about infection prevention and control. According to the Ministry of Health and World Health Organization, infection prevention is a scientific approach and practical solution that is designed to prevent harm caused by infection to patients and health workers. And actually, these are measures that are put forward by the World Health Organization to prevent the transmission of infection from health workers to patients or even to the community. And my role as an IPC person or an IPC nurse is to make sure that those infections are prevented, and in case they have to occur, they must be contained in one area so to reduce the transmission of the infection from one individual to another. The second role is to make sure that we prevent the spread of nosocomial infections, which patients or caregivers get during their care or during their attendance in a health facility. So we make sure that we educate them about the mode of the transmission of such infections and how best they can protect themselves from acquiring the infection. Are you still hearing me?
Yes, thank you very much, Rhoda. I'm hearing you. And I really like that you brought that nosocomial infection that is acquired by attendants within the hospital. Now, I would like you to talk a little bit about how Ugandans are responding to COVID and how are we adhering, because you said part of what teaching us, the people in the community, about infection control and prevention. How are we doing as Ugandans, and what more do we need to do to be able to prevent the spread of COVID in the community?
Yeah, thanks very much. The guidelines were put by World Health Organization and the Ministry of Health, Uganda. If all Ugandans were very accommodating toward those measures, it would register a very high percentage success rate. But unfortunately, it's not because they are not informed, but I think it could be their attitude that they are not abiding by the protocols and guidelines put by World Health Organization, mostly how to put on a face mask, or the one we call community mask, particularly when they're in their communities, and hand washing or hand hygiene, which is very mandatory. But majority of us are not doing that. It's believed that faith is beautiful, but it's often very time-blind. So many Ugandans believe that Corona is not for them, especially the people with black skin. And that's making a lot of ignorance that will cost a lot to the community. So it's always very important that the measures that were set by Ugandan government and Ministry of Health, there is a number of educated land and responsible citizens in the country, but some sectors can continue if we really have to allow the partial lockdown in this country, because there are some people who are really educated, who are really learned and responsible, that can abide by the rules and regulations and the guidelines set by World Health Organization. But unfortunately, a certain number, they are very chaotic, they are irresponsible, and such may actually increase the spread of COVID-19 in our country. For example, the way we wear our face masks, sometimes you find they are putting their face mask under the chin, they are touching it in front, yet they know they can easily touch their mucous membranes. That could be one of the areas that can increase the spread of infection. The way they wash their hands, you actually think that they are just pretending because someone is there to supervise them. When you go into some areas, take an example, the open markets that were left unlocked, maybe the markets for food, even including the facilities where we work, you find people are not really social distancing. And yet we know that those are areas that can actually predispose most of us, most of our clients, to acquire the infection. Most of our areas in Uganda shake, hugging while greeting, yet we do not have the culture of hand hygiene, which could be the one of the areas that are actually increasing the spread of the infection to our communities. I rest that. Thank you.
Thank you, Ms. Rhoda. It's quite controversial. However, I think that there are some people who think that this COVID thing doesn't even exist, which is why they are not adhering to the measures that have been put in place by the Ministry of Health or the WHO. What do you say to such people, especially now that we see more people are getting the illness and more people are dying from COVID? What do you say to such people, whether they are providers or they are in the community, who say, oh, it doesn't exist? What would be your response as a frontline provider who has been seeing this illness?
Yeah, thanks very much, the moderator. One of the things that the government of Uganda, including Ministry of Health and every health worker, should do is to make sure we disseminate or we sensitize the community that really COVID has no distinction about the race, the culture, and the rest. Every one of us is getting infected, with the evidence that we even have cases that have actually succumbed to COVID-19 in our country who have the same color, the same characteristics like most of us. So giving them the evidence that really COVID-19 does not differentiate and any one of us can get infected, it would be a very good, though we know that the Ministry of Health and other implementing partners are doing so, but there are some people whose attitude is still a very big challenge to change. But they have the information, but abiding by the information and the guidelines given to them is not very easy, which I think it's an attitude that needs to be changed, though we all know that it's very hard to change an attitude because you have to have a gradual process and the steps to be followed by someone to change the attitude. But it's a matter of giving it time, and we continuously sensitize them, giving the evidences of what is happening around us as per today.
Thank you so much. And I think that really brings us to another person who is actually looking after COVID patients. So for all of those non-believers who think this doesn't exist, this is a hoax, and so on, we have a panelist who is a 26-year-old bachelor's degree graduate, currently doing her internship at Chirudu National Referral Hospital. This is Miss Anita. She graduated from Bishop Stuart University in Mbarara with a Bachelor of Science degree. Miss Anita Nwasima, are you here? I know that you are managing both COVID and non-COVID patients. Can you give us some highlights of your experience working on the front line with patients who actually have COVID? Miss Anita, unmute.
Thank you very much, the moderator. As you have all heard, now I shift after like 2 months working in corona patients. Yes, most Ugandans don't believe that there is coronavirus, even those who are infected. In fact, we used to have patients riot, and they want to move, they want to do what they want. Most Ugandans do not believe that there is corona in Uganda. But I want to bring it to understanding that there is actually coronavirus in Uganda. We have seen patients who are dying of recent, but we have also managed patients who had coronavirus ourselves. I want to tell Ugandans that corona is real, but we want to thank God that most of us maybe we have not been affected hardly. Mary actually have coronavirus. Manage our patients with symptoms, but most of our patients in last month didn't have much symptoms, but we used to have patients with high temperatures, we used to have patients with cough, we used to have patients with headache, and more other symptoms. As nurses, I want you to know, as Ugandans, as a community, that actually coronavirus is real. Our community should know that our health system is not as such as that of developed countries. That's why we must try hard as Ugandans to prevent it as right now as possible before the cases are overwhelming. You must all know, as the critical care nurse has already told you, we have very few equipment to manage critically ill patients. Please, Ugandans, I want to assure you that there is coronavirus, and if we will not take precautions, we shall reach an extent of what we are seeing in Italy, what we are seeing in America, and other things. We were lucky that our patients had little symptoms, or most of them were asymptomatic. But I want to assure Uganda that there is coronavirus, and if we do not take precautions, we shall face what other countries faced. Hello.
Thank you so much, Anita. And we hear you as responsible Ugandans. We know that we need to do our job so that you can also do your job. Hello, we can hear you. Yeah, we can hear you. So my next question is, tell us a little bit about the role that nurses and midwives are playing in the management and the prevention of COVID. Speak to us specifically about the role of the nurse.
Thank you very much. Here, nurses are acting as educators, whereby they provide health education talk to their clients. We carry out health education talks in different departments, even those in corona centers, even those in non-corona centers. We carry out health educating the public about infection prevention measures, which includes hand hygiene, includes putting on masks and social distancing in our respective hospitals, medical centers, and wherever we are placed. Another thing, nurses monitor patients. You must all know that nurses are the frontline healthcare workers. We are the ones that spend more time with our patients. As in this, we monitor more. We are more of monitoring the patients more than any other medical worker. As in this era, nurses do monitor our patients. We monitor the progress. We see how is this one reacting? Is there improvement? Is there a need for referral? And we report to other health workers. Another thing, nurses do prevent nosocomial infection. As the other panelists has already told you, that there is nosocomial infection in healthy facilities. Nurses do a lot to prevent nosocomial infection through environmental cleanliness, through monitoring the equipment that we use on different patients, maybe disinfecting. All that is done by nurses. There's also implementation of isolation care, whereby when you see a patient, maybe this one is coughing, this one has fevers, this one has what, before even the Ministry of Health intervened, nurses carry out isolation of patients.
Thank you very much, Anita. It's so good to hear you articulate exactly the role of the nurse.
Another
as an
thing,
educator.
there is sick.
Yes, go ahead.
Hello.
Go ahead.
Yes, there is continuity of care, whereby nurses, most patients interact with nurses because they are the ones available most of the times in the health care settings. As you all know, that nurses contribute 70% of health workers in the hospital setting. So nurses ensure continuity of care to our patients. That's all I can say as fun.
Thank you so much. You articulated well the
much.
role of
Hello.
the nurse as an educator, the nurse as a manager, as a resource mobilizer, as an infection control expert, and so on. And all of those things bring to surface training areas where nurses and midwives really need to focus for the future. And I think all the other panelists have sort of touched on this. I would like to hand over back to Joyce so that we can go right into the questions. We have a lot of questions from our listeners for all the panelists, starting with Dr. Musene, the registrar, Cliff, Rhoda, and so on. Joyce, back to you so we can go through these questions.
Thank you, Dr. Rose. It's good to have you back. And thank you to all our panelists who have been here. Thank you for, taking the time out of your busy day to come and share with us, the general public, and give us assurance about what is happening in the medical profession, how you are being protected and how you are protecting us. Like I said, this webinar is brought to you by Crownell Core Company Limited. It's a body corporate. It's a legal body, but which is interested in addressing topical issues that are affecting us. So it's not only dealing with legal issues, but it's looking at what is affecting you right now. And right now, what is on the agenda in everyone's mind is this whole COVID situation. And that's why now, for today's topic, we are looking at what are the roles of the nurses and the midwives in leading and serving this nation. And also highlighting, what are the effective policies that are helping them in terms of education and investment, and also understanding their roles, as the frontline workers, especially during this whole COVID pandemic, and what lessons have been gained, and, what challenges they've faced, and how can we move on from where we are to where ideally we would want to be. So the panelists have gone through the first round of questions, and now we are opening it up to everyone. Several questions have been coming in the chat room. I'm going to, just now go picking one-on-one any of our panelists to try and answer some of these questions. And as I do so, I'm requesting my co-moderator to pick up some of the others that I might have left out. So I'll start with Cliff. This is a question for you from Nurse Kagoga Rogers. And the question is Mbarara University having all that it takes to train nurses in critical care, or do we need to go abroad for such specializations? And maybe in line with that same question, there was another question that is talking about, since you've talked about that critical care nursing, we have so few specialists, what is the cost of this training? And is it the kind of cost that is affordable for more that would want to get involved in that? So maybe you could address us on the cost of it, and also its availability. Is it available, or do we need to go abroad? Because this is very critical to all of us. So over to you, Cliff.
I thank you, Joyce, and thank you, listeners and my fellow moderators. A great question from Kagoga Rogers, and really, you are pinning on something which bothers almost every nurse. That does Mbarara have the capacity or what it takes to train critical care nurses? I'll definitely say yes. The reason is that Mbarara is an accredited institution, accredited by the National Council of Higher Education in this country. Mbarara, as for years, you have known that it has been existing as a university that trains doctors, nurses, and so on. And a few years ago, Mbarara started the specialized critical care training program. And it has successfully graduated over 40 nurses so far. And these nurses are some of the few nurses who are actually training nurses in different universities, who are even mentoring nurses in different regional referral hospitals, in these private hospitals, who have put their effort really to do what has not been done enough. And that is because Mbarara has that capacity to have instilled that training. And even Mbarara has partners that are working with them in training nurses locally and internationally. I know Mbarara has faculties coming from USA, coming from different parts of the world. These are very experienced nurses, experienced health workers of different categories who come to train nurses in this country. I'll definitely say Mbarara has what it takes. But however, the reservation here, of course, is in terms of output from Mbarara, because if you look at the statistics that I gave you earlier, we only have 13 nurses working in the only 55 ICUs. Of course, this makes a contradiction because 40 nurses who are specialized and then 13 who are working. What does that mean? It means the ICUs are not attracting these nurses who have already specialized. The few who are attracted are the ones you see who are about 13. So that means there's a challenge with the output. The output is few and the absorption rate is also limited. And therefore, that means we can't see a lot of impact from this product Mbarara is producing. Therefore, Mbarara alone will not even meet the numbers that are required to meet the immediate needs of the Ugandan critical care needs. And that will require almost many other institutions to start training critical care nurses. And this will require the expansion of the current number of ICUs in the country. That definitely will meet the needs of the increasing number. And therefore, there is, besides even asking that question, I will even say that I will use this opportunity to say that besides the role of Mbarara training critical care nurses, public service, Ministry of Health, and Health Service Commission really needs to expand the current staffing needs for critical care nurses in the country. so that this important sector of nurses, cadre of nurses, need to be attracted and retained to work in these facilities. Somebody has just posted that nurses are being paid, inadequately. And nurses, if they are not paid adequately, and especially critical care nurses, if they are not paid adequately, by the way, we can lose these nurses to go and work in other countries. For example, I want to give you myself as an example. I did my master's in critical care in 3 countries in Europe, in Portugal, Spain, and Finland. And the European Union gave us opportunity to remain in the European region to work anywhere. But I chose to come back to my country, and yet the rate of attracting nurses in this country remains limited. Thank God I'm still around. And how about others who probably must have left this country? So there's that kind of problem. So let me come back to the question of the cost. I will simply give you the cost of the training of nurses in Uganda as compared to the cost of training nurses abroad. Mbarara University is a very typical example. There's a tuition fee structure that Mbarara University has put, just like any other public university, which I think is affordable to Ugandans. But the issue is there's a lot of competition to get those few 10 or 20 positions to train nurses. So in terms of cost at Mbarara, at master level, yes, it is affordable. Even besides that, the organizations that are willing to sponsor nurses, Ministry of Health recently advertised for those kind of scholarship, which other nurses have applied, and I saw a few days ago, the list is out. Now, let me give you what happens abroad, because abroad out of this country is where critical care nursing training exists. In different countries, in Europe, in USA, in the Middle East, even in Africa, in South Africa, they are available. But I will give you the cost that it takes to train a critical care nurse. Probably, for example, in South Africa, it will cost you about a few millions of 20 million per year to train a nurse. If the course takes 2 years, that means it is about 40 million. But my course that I did in Europe, it costed me 5,000 euros per semester. And this training had 4 semesters. Lucky enough, I was able to get a scholarship from the European Union. And that is what it means. That means that it is hardly affordable abroad and relatively affordable in the country. And that is actually what I can still tell you about the affordability.
Can you give us an estimated figure for Mbarara University? Can we say it's costing about 2-3 million per semester, something like that?
I will not be very exact, but I think, if I remember, it is about 1.5 million per semester.
So it's affordable, but the issue is the slots aren't enough.
Yes.
Thank you so much. Now, I would like to quickly run to Dr. Hajat Safina, who's a commissioner.
On addition,
yes.
In addition to that, the course Mbarara offers is at master's level. So in other words, we only have a master's program current in the country. We don't have undergraduate critical care training. We don't have a diploma or whatever critical care training. So it is only at a master's level. And that comes with additional limitations.
Mr. Cliff, you're making the situation even worse, making us panic even more. So if it's not available, in other words, it's not even available for us. But now let me go to Dr. Safina, who's a commissioner, BT-VET, Chair Nurses and Midwives Leadership Think Tank, which is an organization that is overseeing the midwives' welfare and looking out for their interests. Now, there's a question that has come in, and I think Cliff has mentioned it a bit. It was from Baluku, and he's saying the nurses are paid very poorly. What plan do you have for them? Now, clearly, he's talked about the fact that, yes, we might have some few qualified nurses, but even those do not want to work, in our jurisdiction because they are paid poorly. Now, you as an organization and the chair of that organization, which is looking out for the welfare of these nurses, what are you doing to, promote or to reach out, whether it's to government, whether it's to other institutions, to see that a few medical professions who we've managed to train are actually paid well and are actually ready to come and serve in our community? And then the second question I'd like to ask you also that has come in is, what does the nursing and midwifery training or education, what is it going to look like? Because you said you've been training, your nurses and midwives, prior to COVID. But now what's it going to look like post-COVID era? What changes are you going to make to ensure that, nurses are up to par with what is happening, right now, and how are they developing their skills in light of this new COVID era? So maybe if you could answer those two questions for us, please.
Great. I will start to.
Please, that was to Dr. Hajat. Sorry.
Oh, okay. Okay. Sorry.
Thank you very much. Thank you very much, Joyce, for the two questions that you have posed. And I want to start with the one of nurses are paid a minimum in relation to their output. I don't want to say that the think tank had done enough in this area, because the think tank has come into existence in the last 4 months during the COVID time. And I think that is one of the issues, the areas that you can take on to advocate for. However, I want to say that there are other organizations, including the Uganda Nurses and Midwife Union and others who have been advocating for pay rise for the nurses. And somehow last year, 1 or 2 years back, an enhancement was done to improve the pay of nurses that work in public facilities. But all in all, much as there was that enhancement, it did not satisfy the expectation of the nurses. For example, like right now we are talking about a risk allowance for health worker that is being exposed or having the risk of being exposed to infectious diseases, including COVID. Is that risk allowance available, and is it provided for the nurses? So that's the issue that we need to take on as nurses and see that such pay, such allowances, the best salary for such a nurse is adequate, like how we see it in other countries. But also, Joyce, I want you to appreciate that much as government is the major employer for health workers and nurses inclusive, these nurses are also employed by other people as organizations. We have private for-profit hospitals, we have private not-for-profit hospitals, we have individual facilities owned by operators, and in most cases, nurses that work in such facilities are even on a higher disadvantage as far as appropriate pay is concerned. So let me say that as think tank and with the membership that we have, I did not inform you that Cliff and Rose are part of the think tank. We will take it on and we will ensure that we advocate with the relevant authorities, Health Service Commission, the public service, and everybody so that they pay for the nurse. And everybody has appreciated during COVID-19. While others were told to go home, a nurse was made to remain and work. So that has shown that a nurse is an essential human resource that we cannot avoid, and therefore we need to motivate her appropriately. Lord, that's what I can say as far as COVID, as far as the pay is concerned. But now I wanted to go to COVID-19, and now we are preparing as education for reopening. I remember that day that cannot get out of my mind, because it was on 18th March when we received a pronouncement that all education institutions are to be closed. And that did not leave the nursing and the midwifery education institutions, including the universities. All the schools were closed, and later on, the principals and the rest were called upon to provide security on staff. All this brought a lot of challenges. We have got through psychosocial impact, where at the beginning we thought it was a relaxation, we are going to rest for 1 week and so on, but later it ended up into boredom, ended up into frustration and so on. While we are in that boredom and so on, as education, we started thinking and seeing how best we can see that these students get continuity of learning And as the Minister of Education and Sports, a task committee was put in place to discuss issues of COVID-19 and the education-related challenges. And this committee were looking at what is that we need to do to open up the schools. Therefore, we developed the guidelines. What are those things that we need to follow to open up the schools? Therefore, we consulted the Minister of Health to provide standard operational procedures for opening up education institutions. So consultations, meetings, and so on are going on. And as we are doing that and so on, the institutions and all of us in the education sector realize that life will never be the same as it was before COVID. Now, it has brought on board issues of rethinking how to deliver education. We are now thinking about digitalization of education, online training, maybe getting videos, maybe getting. I'm thinking how best we can help our trainees. But also we are thinking of how we can counsel our trainees. You know, some of our trainees were almost qualifying. They had 2 months to qualify, they had 1 month to qualify, 2 weeks, and so on. And therefore they are having a lot of social psychology challenges, and we need to support them mentally so that they appreciate. We are thinking of now observing the operational standard procedures that have been put in place, and one of them relates to distancing, another one relates to use of masks, then the third one relates to provision of all the facilities that have been said as far as managing COVID-19. Because of that, we are thinking of a model which is being developed by Nakawa Vocational College that will provide a platform where materials can be provided for the students, and then the students can interact with the teacher, and then the teacher can provide the feedback, and the feedback that can even be shared by the parents and guardians. As we negotiate for that, we also feel a challenge. You know, medical profession, nursing education is not theoretical training. It is a training that requires you to have a face-to-face interaction with the trainee. It is a training that requires a trainee to be in the clinical area and practice. It is like a law, Grace, you know this very well. It is like a law where you need to go in the courtroom and practice your legal competences. Even in nursing, you need to go to the hospital, you need to be in touch with the patients and so on. So as education, again, we are looking to how best we can enable training to go on, and discussions are on. Assessment, how assessment will be done. How shall we make our trainers who are now out of the hospitals remain relevant to serve and train our trainees? You know, they have taken like 2-3 months without practicing their practice. You know, they must teach what they know they have done and how to improve their capacity that they are able to deliver. Now, the challenge of all of this that we are thinking about is, as a country, when we talk about online training, is the infrastructure. We have appropriate infrastructure to deliver such. We have appropriate e-learning libraries in our facility with adequate internet connectivity, with availability of power supply. You are even experiencing this during this webinar that somehow we are on and off. Our infrastructure that we have is a challenge. And we have come to appreciate that managing COVID and managing nursing education, it is not a one sector's issue. It is a multi-sector issue, and we want to bring on board all the other relevant sectors, ICT, Ministry of Health, everybody to see that we move on. But we are appreciating that life must continue with COVID, and the nurses must be trained in the various specializations. And Joyce, I just wanted to make one comment about the specialized nurses that Cliff was talking about. And I'm saying as education, we have a policy that when a need is there, then we train for the country. And as think tank, I think we shall take that on forward to see that the critical care nurses that are required for this country are not only trained at master's level, but also at a diploma where somebody can come for 1.5 years or whatever model that will prepare for them, and will provide well-skilled nurses for the country.
Thank you so much. Thank you so much, Dr. Safina. If for nothing else, the fact that we've had that is already a green light, and we're already considering ourselves a success in this webinar. The fact that, once we have a platform like this where we can issue out our concerns, like right now, one of the concerns that has come out is the need for critical care nursing. And now we've got a commitment from the chair of the Midwives Association, Nurses and Midwives Association, that it's something they're going to take up. It already tells us that, we are doing something and we're making an impact. Now, I also have a couple of questions that have come in for Madam Registrar. I hope you can hear me. And one of them is, there are actually quite a number. One of them is, how do we help, you talked about registering nurses, for them being able to access the internet in order to have, online registration. So they're saying, how will you help other nurses who will not be able to access internet pertaining to the online registration? So that's the first question for you. Then there's another question from Perry to Muhaire, and he says, will the council charge nurses for late registration since COVID-19 has affected movement and income generation? So are you going to, charge still for late registration, and yet there's this pandemic that has affected everyone? Then there's another question for you, Madam Registrar. And this is, Mbarara University started a diploma in emergency medicine. Nurses and midwives may have enrolled on this program. However, will these nurses be registered by UMC as emergency nurses? So those are some of the questions.
Joyce. Yes.
Please continue, Madam Registrar.
Thank you, Joyce. I think I have answered some of the questions on the platform where they are writing, but I need you to be giving me those questions one by one because I've not registered them.
Okay. The first one is, how will you help the nurses who are not able to access internet pertaining to the online registration? Do you have an alternative?
But that's what the nurses want. Every nurse right now is crying that, why don't you go online to register us? And yet there are the very people who are saying they're having challenges of net. UNMC doesn't have any other way of them. We believe that each nurse is having a phone and they are able to get data. They will be able to do the registration. It's just like when we are applying for jobs. Right now, whom are they going to ask to give them data to apply for a job, for example, in Health Service Commission? They have to have their data, and I apply to do that interview, and we register them.
Thank you. Okay.
The other question?
Yeah, there was another one. Will the council charge nurses for late registration since COVID-19 has
answered that question many times to many of them, and we are saying that if the nurse's license expired by December 2019, they are subject to charge.
Okay.
The nurses know that one.
Okay.
By 2019 December, they are liable to be charged. But if the license expired from actually January to December, because the license is expected to expire in December. if it expired in January, December, of course they cannot be charged. But if this COVID goes beyond this year, 2020, and it goes up to 2021, and they are unable to come and register, then we shall not charge them. I have answered that question. But they should not do that deliberately, not to come and renew their licenses because they want to wait until next year so that they come and renew.
Okay, so there's one quickly. Mbarara University started a diploma in emergency medicine. Nurses and midwives may have enrolled on this program. Will these nurses be registered as UNMC, by the UNMC as emergency nurses?
I'm not sure what kind of nurses those ones are. Are they at enrollment? Are they at diploma, masters? What we are having by the Act, because the registration of nurses is stipulated by the Act of Parliament. By the Act, we register all nurses as registered nurses or enrolled nurses. Then if they do a Bachelor's of Science Nursing and they do that critical care nurse at masters, then that is where they have specialized. The Act does not provide for registering nurses at diploma when they have done a specialty course. We take that as a continuous professional development.
Okay. Thank you. And then one last one for you is, can you talk about a time when, what does it take for a nurse to open up and register a clinic? Madam Registrar, can you hear me? Madam Registrar, can you hear me?
The requirements is that if someone, I have heard you, Joyce, but I think my internet has a challenge. I'm hearing you, Joyce. Hello?
Yes, I can hear you now. Did you hear my question?
Wow. Hello?
Did you hear my question?
Yes, I did hear your question.
Can you please respond to it?
Repeat the question.
Yes, someone wanted you to talk about the time a nurse is, once a nurse is registered, what does it take for them to open up and register a clinic with you?
Yes, to register a clinic, if a nurse qualifies, is stipulated by law, by the Act of Parliament. And we are still using that Act, which is, of course, under review. And we are trying, when we review the Act, I think that the time will change. The time currently is the registered nurse should have practiced for about 10 years. And then the midwife should have practiced for about 5 years in order to open her own clinic. That's what we have. But when we review the Act of Parliament, I think those times will change. Now that we have people who are specialized, like my brother Cliff, I don't think they should have worked for 10 years in order to open their own clinic, sincerely, because they have already specialized in that area. So the Act will have to capture that one in its review. Thank you. Yes, Joyce, I have submitted. Joyce, you are not hearing me, I think.
Yes, hello, can you hear me?
Yes, I can hear you.
My network seems to have had a small challenge. I don't know if you can hear me right now.
I'm hearing you.
Hello?
Yes, I am hearing you, Joyce.
Okay, this is now the final one for you. I know there have been several for you, and this is really talking about decentralizing the whole process of registration instead of everyone having to ingest in Kampala. Can you quickly respond to that? Then I can move to the next panelist. Thank you so much, Madam Registrar.
Yes, we had discussed about that, but now we have changed the course. We want to go digital, and now how can we start doing decentralizing when we're going digital? It will be easier to decentralize when we have gone digital, and our satellite centers that are in the regional hospitals will be easier to communicate with us. So that one is the process. It is not just waking up from your bed to say, I am going to decentralize. There are so many processes that will involve, because we have to relay all those issues on our system. So if we automate the system, it will be easier to decentralize, such that it will be good for them to go to those regional satellite centers and their information is relayed direct to our system at the headquarters.
Okay, thank you. Thank you so much, Madam Registrar. I don't know, Rhoda, are you there? Can you hear me?
Hello?
Sorry, Dr. Rose, are you there? Can you hear me? Dr. Rose, can you hear me?
Rhoda speaking. Hello?
Dr. Rose, can you hear me? Dr. Rose?
Rhoda speaking. Hello?
No, I'm requesting for
Hello?
Dr. Rose. Dr. Rose, I can see you. Can you hear me? Okay, well, I think, Dr. Rose, I don't know if you've picked up any more questions in the chat room. Okay, I don't seem to see any, except there's just one more that I can identify here. And it says there's a complaint about registration of private clinics for nurses after 10 years, while paramedics are allowed after 3 years. I think this is to Madam Registrar. Maybe that could be your final question for the day.
What is the question?
There's a complaint about registration of private clinics for nurses, that it's after 10 years, whereas for paramedics, it's only after 3 years. Saying, in light of
nursing. Paramedical course is different from nursing. We use different accents. So nurses must know that they have an act of that controls them. And we cannot change otherwise. I submit.
Okay. Thank you so much. I see we have about 9 minutes. Now I'm going to request some of our panelists who I have not been able to see a question directly to them. I'm going to ask them to just give us, just a final wrap of what message they would like to give our viewers, because I see we have about 8 minutes. So I'm going to ask, is Rhoda here? Can you hear me?
Yes, I can.
Rhoda, can you?
Hello?
Yes. Rhoda, you have about a minute or two. Can you please, your final words regarding what we've been discussing here today? Especially as a nurse who's been on the forefront. Rhoda, we can't seem to hear you.
Yeah, very soon in Turkish. Hello?
Yes, now we can hear you.
Yes, I'm saying. Hello?
Yes, we can hear you.
Okay. As an infection prevention and control nurse, this is a guide to each and every individual in this country that we need to abide by the guidelines set up by Ministry of Health on preventive measures. We all know as health workers there is a lot when you look at the patient population ratio of the nurse as compared by the guidelines from the World Health Organization, which is 2.5 per 100 clients. not very easy. I know most of us are getting infected because we are overworked, because of the workload, because of the long working hours and the rest. But it's very important for our safety and protection. We need to abide by the rules that are set by the World Health Organization and Ministry of Health. The other one is to make sure that as Ministry of Health and people in the country, we need to establish the regional and national team experts so that in case of any emergency, or an outbreak, there is a team already to be deployed in any part of the country where the outbreak is. I would also think about the engagement of crucial disease outbreak and containment in the system guidelines, standard operating procedures, and the rest. We need to put them into consideration and make sure we are safe. Then lastly, we need to inform each and everyone to define the chain of transmission or the chain of how the infections can be spread from one person to another. And lastly, I will talk about the communication command, that there could be a center where all the communications could go to and come from before they are dispatched into the community to avoid errors in communication. I submit.
Okay, thank you so much. Thank you for those final words. I'm also going to request Anita. Anita, are you on? Can we just have one word from you before we wrap up today?
Hello?
Yes, we can hear you.
Hello?
Yes, we can hear you.
Yes, my lecture is to appeal to the public, at least the public and the popular people, to respect the commitment of, I think it's been to always value protective equipment through staff, even some of us who are not working in corona centers, we need to be protected because we don't know who patients we are dealing with. So it is important for us to be protected through by being provided with masks and other protective gears. And the other thing is the community should be aware that we can control coronavirus through the guidelines that the Ministry of Health has put in place by washing our hands, social distancing, and putting on our masks when we are in public. That's what I can say. Thank you very much.
Thank you so much, Anita. I see a burning comment from Cliff. I'll let you be the last person because we have about a minute to go. So, Cliff, can you give us a 1 minute wrap up before we close today?
Thank you. First of all, I want to thank the mobilizers, the organizers of this webinar. First of all, this is what always critical care nursing has always looked for, to look for partners who can work with them. And one of our roles as an organization is to develop skills of critical care nurses and build their attitude. And with that in mind, I want to say that we have a lot of work as critical care nurses in this country to do. I highlighted earlier that our number is inadequate. Resources are inadequate. The skills are wanting. And we need support from different organizations and partners to build this skill so that we can make this country a better place where nurses can provide quality critical care services. And looking at this as one of the big opportunity, we're looking at a future where post-COVID, we are going to be proud about different ICUs that are going to be staffed by skilled nurses. We're looking forward to government retaining their nurses and really appointing them and giving them appropriate salary so that we retain these nurses. And therefore, what I want to say is that this is the kind of thing, arrangement that we really want to look for, especially where there's COVID lockdown, where we can't move. Innovation of using social media or platforms like this to discuss some of the issues is very important. And therefore, I want to applaud everybody who has been here, that if you have any further information or support you want to give us, I've put my telephone number there on chat group. We need support from different organizations to really support nurses, to build their capacity, to make them a better nurse in this country, and motivate them so that they can do a good job in this country. Thank you very much.
Thank you so much, Cliff. The questions are overwhelming. They're still going on in the chat room. So I'm going to request our panelists, please stay on. Much as our time has run out, please stay on and help us answer many of the questions that are in the chat room. I want to thank all our listeners, those on Facebook, those who have been on the webinar. We are so grateful you took the time to be with us as we discussed this important topic. As we all know, COVID has affected so many people, but we wanted to hear from those on the front line. What are they going through? What are their challenges? And where do they see the future? And also to have an opportunity to interact and see how can we pull our different resources from our different sectors to help one another to push, for the betterment of our nurses, our nursing profession, and those who are on the front line ensuring our health and safety. So I want once again to thank our panelists, from Dr. Hajat Safina from the ministry, from Rhoda, also Dr. Rhoda, from Madam Registrar Angela, from Anita, our nurse on the front line, and Dr. Cliff. You all, we are so glad that you took the time. Thank you once again for being with us. Please continue answering the questions. And for all of you who've been listening, I am Joyce Katende with my co-host, Dr. Rose Clark, who unfortunately was challenged with the network, but we are so grateful. And thank you once again to Crown Elco, who has organized this whole setup together with Sinbel Advocates and the nurse, discussing the future of the nursing profession and healthcare. From all of us, God bless you and thank you.
Thank you, Commissioner.
Thank you very much for this opportunity.
Thank you, thank you, thank you.
Thank you, Joyce, for hosting us. It has been something so wonderful.
Thank you, thank you. We are so grateful that you were here with us.
The brain behind this really has done a very wonderful job. And we wish such a things will be continuing to happen so that we pull our resources and brains together to build this country.
Thank you.